everybody, welcome back. Dr. Blumenthal here, Natural Transplants in the Bethesda office, and we have GP here today. GP, you're coming in from Virginia, right?
Yes.
Okay, awesome. So we are more excited than nervous today. That's what you tell me.
I'm a little more excited than nervous.
Okay, awesome. I'm excited. I think this is gonna, we'll sort of show you, but I think this is gonna transform you, man. This is gonna be awesome. So if you wouldn't mind sharing with everybody, you know, what brings you to us, how you found us, that sort of thing.
Basically, how did I find you guys? I think I was looking up like different ways or places that do hair transplants, and then I saw that you guys were like popping a lot. So then I clicked on the videos that you guys had, and mainly the videos helped me. Like, okay, a lot of people are going through this, and the end results I'm able to see, and let me give it a shot.
Cool.
I want to know how well it will look on me, and since I'm a little bit younger,
and you're
that can benefit.
How old are you?
I'm 23.
23. Okay. All right.
23.
And when did you start losing your hair?
Like around possibly 18.
18.
Like around
Okay.
18. Yeah.
All right. And I'm gonna mess up your hair a little bit because you're doing the sweep, which is great.
Always.
But let's see kind of what it really looks like. Put your head down if you don't mind for me. So this is what we're working on today. And the hairline is the number one goal today, right? That's number one priority.
Yes.
And we're just gonna do the hairline in frontal third, no question. And then we're gonna work back as far as we can go. And you can see this is miniaturized here, this hair back here. So yeah, as we said, I hate to tell you, but that's probably on its way out at some point, you know, as I'm sure you know. So that's what we're gonna be working on today. Awesome, man. So I appreciate you doing this. This is fantastic. Hopefully you can, like you seeing other videos, hopefully other people will see this and kind of be inspired. But
Yeah, definitely.
that sounds great. So we'll do a little bit of drawing, a little bit of shaving, and then we'll check back in with you and see how we do.
All right,
sounds good? All right, let's get started, man. Thanks. Okay, we are back with GP, and as you can tell, he looks a little different. He did not lose a bet. So we drew in the hairline. That was his number one priority, this frontal third. And after we did that, he actually sort of mentioned maybe the temples as well. So we actually drew in the temples, and I think it looks a lot better on him, and he agreed. So we're going to work a little bit on the temples, reinforce the temples a little bit. Because we're going to be working on the temples we talked about, that's going to be taking some hair away. We probably will not be able to get anything further back than this frontal third. So we're going to really focus on the hairline, frontal third, and temples. That's probably as much hair as we're going to be able to get. If we have extras, then we can always go back and do that as well too. How you feeling, man?
They're great.
Doing all
right?
Excited. This is awesome. I think it's going to look great on you. If you wouldn't mind, you know, what we were talking about before, what instead of doing the other things, you decided to do this. What were the other things that you were talking about, you know, as far as other possibilities?
Options that I was looking into was maybe just like shaving whatever part I was balding at, and then possibly like putting some glue and then getting those caps that I've been seeing a lot. Yeah, like the hair caps and all. But then I would always think about like that's a continuous thing that you're gonna have to keep doing, and glue and everything. So I might as well just get it done on one seat. And
your own hair, you can do
it's
your
your
swim,
own.
you do whatever you want.
Exactly.
Yeah,
so much better.
Awesome. Again, appreciate you doing this for everybody. Let's get going. We'll check in with you during the procedure, and then at the end. And I'm excited, man.
Me
You ready?
too.
All right, let's get going.
All right, fantastic.
All right, GP, what's going on, man? How you feeling?
Numbed.
Numbed?
Very numb.
How's today been so far?
So far, so good.
So far, so good.
Lunch. Been here quite a bit, but really numb. Excited to finish.
Awesome. We have about 15 minutes to go.
Okay.
Just kind of putting the finishing touches up, clean you up, and then after that, we'll go back in the first room and go over all the instructions, what to do, what not to do, all that sort of stuff.
All right.
All right, you doing okay? Hanging in there?
So far, so good.
Okay, man. I'll check in a little bit.
Awesome.
Okay, everyone, welcome back. We are here with GP. We made it, man.
Yeah.
Congratulations.
Awesome.
All right, so this will be the anniversary day of when you got hair. All right. So overall, be honest. How was the day? Good, bad?
It was a pretty good day.
Yeah.
I mean, started off very excited. I still am. I'm waiting for this hair to grow. Look a little weird, but
Yeah, a little swollen.
a little bit swollen,
Yeah.
but it will go away soon.
Good.
We'll go for that.
You did great with the injections.
Yeah.
You fell asleep for a period of time there. Had some lunch. Overall, not too bad today.
Not too bad.
Other than
Got
no
to have
coffee?
some friends.
Yeah.
Not other than no coffee in the morning, but worth it.
Very cool.
Very worth it.
All right, we're just gonna take a closer look here. Let me have Ron come in. So you can see the hairline. We got good coverage all the way through up that frontal third, and then the temples on each side as well too. And I'm really glad we included that. I think that really makes a big difference in your look. I'm gonna show the incision here. See the incision all the way around, and even if you go down to a 3-yard, you're not going to see this. Looks really nice. Came together very easily. There you go. Awesome. All right, so rest today. No going out and partying for 2 weeks.
Oh man.
All right. Any words of advice for anybody kind of contemplating, thinking about it?
Get it done.
Yeah.
You won't regret it. Because honestly, oh man, I can't wait. I just can't wait.
And again, like what I say, sometimes the hardest part is the waiting. 3 months from now, 6 months from now, when you really want to come in, you just gotta be patient with it.
Yeah.
But I appreciate you sharing with everybody. This is awesome. Hopefully we'll see you in 4 months, 9 months, and a year. We'll follow up with you. We can do some videos and show everybody the progress.
Of course.
Cool, man.
Definitely.
Awesome. Thanks for doing
Thank you so much.
All right, cool.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.